Good morning, good afternoon, everyone. Thank you so much for joining our call today. Today's presentation is Optimize Your Investment in NextGen Practice Management Sliding Scale. Your presenter today will be Jeff Milden. If you have any questions during the call, please feel free to put them in the Q&A chat panel, and we will be recording the call today and make sure you all have access to that recording after the event. Jeff, I will pass you rights and you are good.
Awesome. Thanks, Marnie. Well, again, good morning, good afternoon, good evening, wherever you are. I'm Jeff Milden, and I'm an application specialist here at NextGen. That's kind of my cool, groovy title. I'm really more the nerd with social skills. That's what I do. And so welcome, everybody. I'm going to share my screen here in a second. I'm going to turn my video off just to give us a little bit more bandwidth, but I just wanted to welcome you kind of in person and virtually, and we'll get going. Let's go ahead and dig in. So I'm going to stop my video. I'm going to share my screen. So today we're going to talk about sliding fee, and sliding fee is an important process for my community health centers. Really, adjusting those fees, sliding it down based on your rules and based on the income of the person that you're seeing as the patient. So we'll go over some alerts. We're going to talk about the demographics and, where you capture the information, the family size and income. We'll talk about some capturing documentation with that sliding fee, encounters, how to write them off. And then we'll go into a little bit of the setup and then one thing on the background business processor that we'll talk about. So that's kind of the marching order that we have. So first off, if I've got a sliding fee patient, I'm going to use Martina as my example. So when I go into her account or access this particular patient, the first thing that I see are some alerts. And so I've got various things like she's got a big balance with us, etc. But the alert that I'll bring your attention to is, of course, the sliding fee one. And so we see that she is on my medical sliding fee schedule. She's at 75%. Here's her family size or annual income. I have mine set for a minimum value. And so the way I have it set up is it slides all the way down, in my case, to $5 and then stops. So I've got mine configured that the patient does like a minimum donation to the clinic, almost like a copay. But again, you can set that up how you want to. And I can see that we've last verified this on the first. So how'd this get in here? We'll go there next. So I like the alerts popping up, so I immediately know that this is a sliding fee patient. This is great for the front desk as they're checking in. This might be as part of the auto flow check-in process. You may pop up the alert for the sliding fee as well. Drilling down a little bit further on Ms. Perez here. When we go into their demographics, so there's a tab called UDS, and that contains information, demographic information that comes, that ends up on your UDS reporting. And the other items on the UDS tab is the sliding fee verification, my head of household, and the family size and income. This is where the sliding fee, where it looks to determine that slide. Patients can have multiple slides if you want to. So Martina has a medical slide and a dental slide because I might slide them differently. Really, any kind of range of CPT codes you can create as a slide. And so if I've got, maybe my medical that slides one way, dental another, behavioral health might be different. A common one is lab. If I've got a certain cost to that lab, I don't want to slide that down below my cost. So we're at least breaking even on that thing. And so you could have a separate set of slides for, lab or other services that you might be doing. Here's where you select the slide. So I can select that this is a medical, or this is a, class A, or, whatever I've got a combo med lab dental one in there. My effective from and through date. So this slide is good. Looks like this year. With my family size and income, you can document that, okay, their current family size. So she's got a family size of 2. Here's her annual income. Again, the income cycles can be selected. So if they bring you a 2-week pay stub, for example, I can put that number in and put biweekly in the cycle, and it'll calculate the annual slide. So it depends on what they give you for proof of that income. They can it'll calculate it for you. We verified this back on January 1st, and we're going to make this effective January 1st through the end of the year. So that's where, as a check-in person or registration person, we can gather that information. And again, this drives with the federal poverty guidelines where that slide ends up. So a little bit later, I'll show you the guidelines in a minute. I'm also collecting on the UDS, if things that end up on your UDS report. So homeless status, school-based language barriers, veteran statuses, those type of things come off that demographic screen of the UDS. I have organizations, FQHCs, that make this UDS tab as a required element. And so it makes the registration folks fill it out. And I've got groups that, just train to that and have them fill it out. So again, it's up to you on how you set that up. Over here, I'm going to highlight this clinical histories and notes. NextGen has what's called document management, and document management is really our scanning solution. This is where I can take, outside paperwork. So if Martina shows up and we, did her slide and she gives us, maybe I need some proof of income, I need a proof of address, like a power or utility bill, I can take that information and scan it into the system, and we can categorize it, and it's going to land in this document management piece. I have groups that put it here. I have some groups that scan it into the medical record and categorize it over there. And I have groups that make it end up in both places. So mine's a both, but just again, there's other ways of scanning it in and categorizing it. And I have groups that do it different ways than I do it. And again, it's up to you. So you can do it how you want. I like this one just because it's right here in front of me, and it's in PM, where probably the person that's going to do it is going to actually scan it in. And so I've categorized these as just patient intake paperwork, and I've got an address verification and income verification. And if we, take a look at that, like that income verification, that pay stub pops up for me. So I've got it categorized specifically. Again, this category could say pay stub or power bill. I made it a little bit more general just for demo purposes. But this is where I've got it landing. So once the slides are set up, automatically when I do my charges, whether they're coming from the medical record, so the providers are doing their thing and the charges come over, I've got mine automatically sliding. This could happen if your workflow is that you look at charges during checkout, or if I have billing do it later. Basically as soon as those charges hit that, it's going to slide automatically. If I go over to my encounters, you'll see that I've got an encounter on the 5th here that we put in a few days ago, and here's my office visit, and here's that sliding fee adjustment. You can have it do an alert when it slides if you want. I usually turn that off, but if we go into her ledger, you'll see here's that office visit, and then here's that sliding fee adjustment. So based on her family size and income, based on the federal poverty guideline or a custom one that you've done, it's going to slide it. And then again, mine goes down to a $5 minimum. If it slides past that, it ends at $5. And what's good about this slide is that I'm not carrying that information on my AR if I slide it immediately. So I have groups that disagree with me here, so it's not it's not gospel, but I have groups that if I would bill this, it would still bill at the right rate, but they wait and slide it at a later time on a monthly basis or something. They'll slide them all in a batch, so that's possible. But I like them sliding immediately, especially if they're private pay. If they're private pay, there's no really reason to wait for it. We'll talk in a second with if I've got an insured patient, you can slide it after the insurance has paid their portion. So I may bill it out. I get, it gets adjudicated by the payer. I get my payment, and then I slide it. Those are better in batch, I think. And I'll show you that here in a minute. But those are better doing them in batch instead of having somebody come in and slide them. All right, let's hit some of the setup on this. So a couple things on the setup. Number one is in the practice preferences. So I'm going to go to practice preferences. And there is a practice preference area called sliding fee. And the sliding fee area allows me to say that, okay, if I've got insurance, I don't want to slide it immediately if the insurance is attached, or don't slide it if there's a zero balance. Allow an override. Display the percent of poverty. That one's actually pretty popular. That on that alert, I want the percentage of poverty displayed. Here's my sliding fee alerts. We saw those. The verify date, the family size. Maybe I don't care about the schedule name, so I could just turn that one off. And whether or not I round, and again, we talked about this before, but I've got a real-time sliding fee. So in other words, as soon as I put the charges in or they come over, it automatically slides off and I'm done. So I don't have to think about it. So I'm going to go over to file maintenance. So this is where the slides are actually set up, is in file maintenance. So if you go into file maintenance, there is a PM master file called sliding fee schedules. Here are those example slides that we saw before when I was choosing the slides. They're in here. And so if I'm just going to open up a general and a medical sliding fee. So I can name this. Here's my medical sliding fee. I can make effective from through dates. I can define that we need to re-verify this every year in this case. So I can get alerts that, the sliding fee is due to be renewed. We got to make sure and get another pay stub. We need to get another, proof of address, that kind of thing. And then here's my adjustment code. So when it slides, here's the transaction it uses to write off that amount. With my medical slide, when I come in here, here's the table. And so ours is based on the federal poverty guideline. You could build one of these. You could build your own table if you want to. So maybe I'm in a certain county and my guideline is different. You could build this out and put in what, is 100%, 75%, and 50 and 25, et cetera. Here's that minimum value that we talked about. So I've got all mine sliding all the way down to $5. Again, options for you if you don't want to do that. You could slide all the way off. I've said effective from through dates. I've got up to 10 in the family. So there's that number right there. How many columns I have. 1, 2, 3, 4, 5. There you go. This one is an encounter-based slide. So an encounter-based slide is based on the visit. So it's going to slide for the whole visit. You can do a line item-based slide, so it slides individual line items. I think line items are harder for accounting because you have end up with lots of little numbers, and it's just, for write-offs and stuff. I think it's complicated. I'm a simple person, so I like to visit ones. I can have a minimum value. I can do flat rate. I'm sliding by, family size, but I could do percentage. This slide includes, all my codes. You could do a CPT code range. So again, that's that lab example we talked about before. I could set up labs as a separate slide within this range, within these codes, and it would only slide for those codes. So you can set these up really specifically. You can do it diagnostically. So only for certain diagnosis codes, I'm going to slide. And I see this often with behavioral health. We might have a program for substance abuse, for example. And, for my substance abuse folks, we might have a different slide than medical, but they have to have a substance abuse diagnosis code to qualify for the slide. So again, just quick examples. I can have them gender related. I could have different ones for kids versus adults, so they could be age based, or if I've got older population, I might have a different slide for them, and then based on the location. And the location is cool. I have, a lot of my community health centers that have lots and lots of locations. And, I may have a location in a different area. I've got one downtown that, might be an area that we slide differently from one out in the suburbs, for example. but a lot of options to set up your slides kind of, with the programs that you want. And again, you can have as many as you want. And, a patient or a client can have multiple slides. So they can have a lab, they can have a dental, they can have a medical, they could have, behavioral health, all in one spot. Going pretty quick here. One more thing that I'll show you, and this is, I'm going to go to my background business processor. And so I'm sure everybody's aware background business processor is a scheduler for different types of things that I might want to happen on a regular basis. And one of the examples we used before is that sliding fee after the insurance is paid. So I may have patients or clients that, have plans, have insurance. And, maybe, Martina here, she's on Medicaid, and I'm going to build a Medicaid first. It's going to get adjudicated, it's going to get paid, and then after it's paid, then I'm going to slide it. And so in my background business processor, if I can get there, I have what's called my daily processes, because I do these every day. And I've got a bunch of things that are scheduled to happen, like eligibilities and claims, et cetera. But the one on the end here, this number 16, is sliding fee post-insurance. So mine goes out there and looks every day that we had received, payment on some of these folks that qualify for a slide, and it will automatically slide it. So instead of having somebody, when I check my payment manually, check and see if they're slide, and put that transaction in. This, I've got mine waking up, I think at 3 in the morning. Yep, 3 o'clock. So it wakes up at 3 in the morning, and everybody that I received payments on that qualify for the slide will automatically slide using that transaction code we talked about before. So I had a group that, they were doing this manually. The private pay ones, they did a checkout, and when the charges ended up, it slided fine. But the other ones, they were pulling reports and doing other methods to catch those ones that, the insurance had paid, and then they got it, and then they got to slide it. Again, I've got groups that if they're insured, they take the insurance and then write it off. They don't slide it after the insurance. And again, it's up to you on how you do that. But I just wanted to highlight that there's a background business processor job for those post-insurance slides if you need to use it. All righty. One more. And so I'm just going to do an encounter for Miss Perez here. And it's going to be at the main office. We're going to make her private pay. It's going to be this one. And then we're going to put some charges in. So this is a manual one, unlike, if I would do a medical record visit. All right, so let's put a diagnosis code in here. Say she came in with some bronchitis. Order the lab for her. All right. So when I put those charges in, even if I do them manually, you'll see that, okay, this encounter, remember we're a counter-based slide, 31340, a $240 sliding fee adjustment has been created for this encounter. So again, that's that automatic slide we talked about. Even if I put something manual in, boom, it knows the slide and takes care of it. You can remove that alert. You don't have to have that alert on there. I used to do presentations, and I would tell people it would slide and had to go back to show them it slid. So I turned on the alert, and that seems more effective having it pop up for demo purposes. But in real life, I don't have a lot of people using that alert popping up, but you could if you want to. And then one more option. When you generate a receipt for the visit, and we haven't collected any money or anything on there. Again, this is an option. I have those sliding fee transactions available to print on the receipt. I learned this from another community health center. Generally, adjustments and write-offs and those type of things you don't want to have on a receipt. But they told me that they actually show it on the receipt or a statement because, it shows that you got this much worth of service, and we wrote, that sliding fee adjustment, you actually got that for a lot cheaper. And so it showed value to them, that they were giving the patient a lot of value for what they were paying. So again, up to you. But I learned it from them, and they thought it was pretty nice. So I usually highlight that you can reflect those slides on, on the statement or on a receipt you give them, and so they can see it, that you actually, slid it down. So nice little value statement if you want, but it's an option if you want to have that on there. All right, so I wanted to show you one of those in kind of in live, so you saw how that all worked once we knew how they're set up. So we got about 7 minutes. I'm happy to take questions. I'm happy to go back over anything. If anybody, I don't know if I can't see the chat, so if there's anything in the chat, we can address it.
Hi, Jeff. Yes, we just had a question come in that would you please show file main setup for slide that uses fixed rates, A of $25, B of $35, C 45, D 55?
I think I got that.
Okay. I'm happy to repeat it. So it's the file main setup for slide that uses fixed rates where 25, 35, 45, and 55. And the requester also said one person annually, 0, and then 13,590, 13,590, which is what would be under A. I think I have that right.
Yeah. So I, not being able to remember the numbers. So basically, you can set up a slide. It's going to be a flat rate mode, probably by family size, probably encounter based. Let's go away. Sorry about that alert. And so here's my flat rate on there. Again, if I get that in a written format, I could probably set one up. I don't know if that helped or not, but
I would hope so. And I'm sure we'll be able to cover any other questions. We'll be able to review these questions after the call. And if anybody if we've missed something or if we can elaborate any further, we can definitely reach out to you. I do have a few other questions. One is, how do you input self-declared income that is solely used for UDS reporting? The patient doesn't qualify for the slide. So how do you input self-declared income that is solely used for UDS reporting? The patient doesn't qualify for the slide.
let's go back to Martina here. So you can do the sliding fee schedule is separate from the income. So you could capture the family size and income. So this might be self-declared income without associating them with a slide. So you could collect the income for EDS and not give them a slide since they don't qualify, would be the answer there.
Okay. Another question that came in is, how do we add the slide amount to a statement?
Oh, so you can with that sliding fee transaction, you could make it viewable on the statement with that transaction. So it's in the transaction setup that you make that viewable on the statement.
Okay.
Yeah, good question. Yeah.
Another question is, if charges are added or accepted after the patient checks out, is there a way to make the charges slide automatically? This particular person currently is manually adjusting them by selecting the slide fee reversal and then sliding the fee again. Let me read. If they were accepted or added after the patient checked out, is there a way to make the charges slide automatically? Is the key question there.
Yeah. So the timing of it, let's say that my providers don't get done by the time the patient checks out, which is common. It's common. When those charges arrive over to PM, they will automatically slide if they're on a sliding fee. So they'll do that automatically now. So they shouldn't have to do any kind of adjustment unless they don't have them set up to automatically slide. But that's more of a workflow than a. The answer is it should still work fine, but I may be missing some specifics.
Okay. We did have a question earlier on the thread. I wanted to make sure we had a chance to get to it. It says, if you have a slide for x-rays and one for behavioral, one for dental, one for lab, do you have to build the fee schedule for every one of these? And then do you have to add it to the patient record for the adjustment? Or can you create one fee schedule for all types and CPT codes, and then somehow by CPT code have the minimum amount? Does that make?
It does. That makes sense. So in one sliding fee, okay, I've got a sliding fee for MedLab Dental. I can put in multiple ranges. So I could have, a batch for medical, a batch for dental, a batch for x-ray, and only assign one slide to the patient, and it would take into account those CPT code ranges. Like for laboratory, they've got a range here of those, if that helps. And they could be multiple ranges. I could add more than one range also.
Very good. And then 2 questions related to BBP. It says, can you please send us the manual to set up BBP, just like you said, to slide after the insurance posting? And how is the sliding fee post insurance rule in BBP set up? So one is, can you please send us the manual to set up BBP like you just said? It must have been earlier in your presentation you were showing that.
Yep.
Is that something we can send to them, or?
We could send them a BBP manual, or they could go on Success Community and grab that as well. So that's available for them. But the answer is yes, we could send it to them.
Okay. And then the other one is, how is the sliding fees post insurance rule in the BBP set up? And is there a rule already in place to be turned on?
There is. Yeah. So there's a standard job already in BBP for that purpose. And so once that insurance payment is received, it knows, oh, that was done. It dropped to the patient. And then based on their slides, it'll automatically slide it based on that patient's slides that you have set it up. So to an earlier question, it's got to be in there. You got to have the slide in there to make that work. And when the insurance payment shows up, it'll take that leftover amount and then slide that.
Very good. I believe we've actually covered all of our questions. And Jeff, what we can do is if you give me the link, we can get that link to that manual and include it in the thank you that we're going to send out. So that way everyone could have that information.
I will try to locate it.
We'll find it for everybody.
Yep, absolutely.
Well, we are a couple minutes past the end of the call. We appreciate everyone's time today and patience in joining us. We will make sure we have a recording of the call and get that out to everyone, as well as post it on Success Community. Jeff, as always, thank you very much. Very clear presentation.
You're welcome. Thanks, everybody, for joining. I appreciate all the time.
Bye-bye. Have a great day, guys.
Okay. Bye-bye. Thanks.